I'm a mountaineer, so I go to the mountains a lot. I've always spent a lot of time there. During my younger years, I was also very active, and it's probably this sports activity that has caused wear and tear on my knees. The pain was almost unbearable. It bothered me a lot, as I was still working at the age of almost 80. I was therefore also required to make movements on building sites and the like, which were also very painful. I consulted my family doctor, and he tried to contact the hospital in Sterzing because he didn't know what to do. I had to have the examinations, and that was last year in June. And they also decided when the operation would be carried out. So I went to the hospital in Sterzing with Dr. Engel, who explained everything to me, and we agreed on the surgery for the 24th of August.
The personalization of arthroplasty in the field of knee surgery is increasing. The advantage of the technology offered by this system is that I can document what I have cut. I can plan a personalized implantation of the prosthesis and then also have the option of making modifications during the procedure due to the laxity or tightness of the ligaments. And I think this is a significant step forward for the patient. When I explain the operation to my patient, I have a model with which I can tell them that a model of their knee joint will be made using CT, and on the basis of this, I can define exactly how the operation will be performed. In other words, I know exactly how many millimeters I'm cutting here, or here, and at this point I don't explain everything to them in detail, but I'm explaining to them that this technology enables me to fit this knee in the way I think is best, and to document it accordingly.
With this explanation, based on a little previous medical knowledge from the Mountain Rescue Service, of which I'd been a member for a very long time, I realized that the operation was feasible, that it is performed frequently, and therefore I wasn't afraid. On the contrary, it was a rather joyful day.
I have the feeling that patients recover more quickly and also consider their knee to be more stable. So I think the goal of knee arthroplasty should be to get as many patients as possible to a forgotten joint score that shows that they no longer perceive the knee as an artificial knee joint.
I was very positive, and I was surprised at how quickly this operation was actually carried out and completed. I was able to experience the earlier recovery process and live more intensely. The 24th of August was the day of the operation. And then on the 19th of February, I put on my skis for the first time and tried cross-country skiing.